Good morning. Today our class is on emergencies that can occur in a dental surgery or a dental clinic. So we all, as you pass out from this institution, you get your degree, your Bachelor of Dental Sciences or Bachelor of Dental Surgery, and then you go out into the uh, world and then you start your own clinics. But an important thing that you all need to remember is that things will or may not go according to plan in many instances. So if a patient comes to you for dental extraction and suddenly he collapses on the dental chair, that's an emergency. So are you equipped to meet this emergency? Do you have the resources to manage a situation that can arise like that? That is our class today. So what are the duties and responsibilities of a dental professional? You are not medical doctors. We may not be called to treat a medical problem completely. But a few things we need to be responsible for because we treat patients. We are also dental doctors who have exposure to medicine and surgery in the third year. So there are a few things which we need to be responsible for the patient. So first thing is you need to recognize a problem exists. If you do not understand or if you do not realize there is a problem, then by the time you realize it, it will be too late. Second thing is to diagnose the problem correctly. We need to at least know that at least this patient is collapsed due to hypoglycemia or due to cardiac arrest. So we need to differentiate. We need to diagnose what the problem is. And then we have to inform that diagnosis. Maybe it is not a correct diagnosis, but at least we have to inform that to a better trained person and keep the patient alive until a better trained person will arrive, or the patient is shifted to the hospital. So these three are our responsibility. It is our duty towards our patients. And that is why this class, we will talk about how we can recognize a problem, diagnose a problem, and give us an idea beforehand, before these complications can arise when you're on your own, to what to look for when you have faced with an emergency. So most of all medical emergencies that occur in a dental office are fear-related. We know that because patients have an innate fear of dentistry, dental injections inside the mouth, the high noise of the air rotor, all that creates a fear and apprehension in these patients. And that combined with their own medical problems can bring about a medical emergency. Therefore, if fear and apprehension are reduced, the chances of having a medical emergency are also reduced. Now, we come to what is known as a basic life support. So when there is a complication, when there is a situation, what we have to face this by not just arbitrary, we have to have a sequence or sequelae or things that we do or look for step by step. So there is a protocol which is instituted by the American Institute of Medical Emergency Preparedness and American Heart Association. So this, from that institute's name itself, it's a medical emergency preparedness, how we become prepared for any eventuality. So there is a protocol. So it's in short form, it's called PABCD. Now the P stands for positioning of the patient. When the patient collapses, when there is a problem with the patient, first thing that you make sure is that the patient is positioned in the right place, in the right position. For a conscious patient, you can ask the patient to be in whatever comfortable position the patient wants. But for an unconscious patient, the patient is put in a supine position. The head at the same level as the body. That is flat, the head or the face looking upwards. That is supine, flat. Head at the same level as the body and feet slightly elevated. So in a dental chair, usually the head can be in a higher position, so that has to be down, lowered. And our chairs has to have that. You shouldn't have a dental chair that cannot be, the backrest cannot be lowered. So it has to have that provision. So the head at the same level as the body and feet is slightly elevated. This is the position that you need to put the patient, unconscious patient, immediately when there is a situation. So again, position, then you have airway. So PA stands for airway. So keep the airway open. So to have that, you need to tilt the patient's head upwards, and the chin is also lifted. You see in the picture below how that is achieved. With your right hand, you can tilt the chin upwards, and with your left hand, the head is tilted downwards. And that makes the extension of the neck possible. And you can see the airway is now in a straight. So make sure the airway is open by using this particular maneuver, head tilt and chin lift. So the third is the breathing. Assess the breathing. So to continue, for assessing the breathing, what you need to do is to assume a position that is shown on the right side. This is the patient, and this is the rescuer or the doctor. And you assume this kind of position, that is your head. The doctor's head is placed against the patient's face, or the ear is placed against the patient's face. And with your eyes, you are able to see the chest rising up or down. So to assess the breathing, look, listen, and feel. Look at the chest cavity, chest going up and down due to breathing. Listen to the air, or hear, if you can hear the air entering and exiting through the nose or the mouth, and feel the air that enters and through or exhales, patient exhales. So that is how you assess the breathing. Now for the circulation, you have to palpate the carotid pulse, not the peripheral pulse, but the neck, carotid pulse in the neck. And the D part is for the definitive care. So categories of medical emergencies. In this presentation, the emergencies will be categorized by those most commonly seen by the dental professional. And they are unconsciousness, respiratory difficulty, altered consciousness, seizures, drug-related emergencies, chest pains, and cardiac arrest. Of the four, the most common ones, and the top ones are the most common ones that we see. And chest pains and cardiac arrest are also there, but comparatively less. So most common emergency that we face is unconsciousness. It's called syncope, when it, or it can be it can be of three varieties. One is syncope, one is orthostatic or postural hypotension, and third is the acute adrenal insufficiency. Now we come to the vasopressor syncope, the most common complication that arises in a dental practice. The cause is due to sudden loss of consciousness, secondary to cerebral ischemia. This can be due to two causes, can be psychogenic and non-psychogenic. Psychogenic means cause of fright, anxiety, stress, hearing a bad news. All this can bring about psychogenic causes that causes unconsciousness. Sudden unexpected pain Patient is seated on the chair, and suddenly there is a sharp pain of a local anesthetic injection that can cause fear and syncope. Sight of blood in some patients can bring about it. Non-psychogenic causes are due to erect posture. So psychogenic are most commonly seen in dental clinic because we say stress and fear related. In non-psychogenic is like when you have, if you've seen army personnel lined up or police people lined up in the parade ground and in an erect attention posture. After some time, in an erect posture, there is a pooling of blood in the lower extremities, which causes reduction of venous return into the heart, which is again one cause for syncope. And these policemen or army jawans are seen to fall during their parade when they are in erect posture without moving their limbs for a long period of time. Hunger is another cause, exhaustion, overworked, poor physical condition, hot, humid, crowded areas. Males of 16 to 35 years are most commonly affected by syncope. Now, the syncope can be clinically seen as pre-syncope and syncope before the patient actually falls or becomes unconscious. They'll have a feeling of warmth or a pre-syncope symptoms. Those are feeling of warmth, then cold sweat, even if there is no heat in the air-conditioned room, they'll start sweating, nausea, and tachycardia, increased heart rate. And that leads to syncope. And in syncope, you have respiratory depression or arrest. Respiration can be depressed. Pupils can be dilated in those patients. Convulsions can be seen, very common. Patients suddenly go into convulsions. Bradycardia, that is, initially there was tachycardia and then it becomes bradycardia or slowing of the heart rate, which causes hypotension, increased blood pressure, and causes loss of consciousness. So how do you manage syncope? Shake and shout. That is, you give a sensory stimulation. Shake the patient, shout at them, wake up, wake up. Those are, you can shout at the patient. So, keep the patient supine with feet elevated. Follow the protocol, PABCD. So position the patient, airway, check the airway, or straighten the airway. Check for breathing, circulation, and decide what the treatment should be. So again, reassess the diagnosis. Make sure that it is syncope and is not due to, say, reduced blood sugar level in the body.